How is type 1 diabetes diagnosed? Imagine feeling extremely thirsty, needing to urinate often, and losing weight without trying. These signs can be clues that something is going on inside your body. When doctors suspect type 1 diabetes, they use a few key tests to find out for sure. First, they might do a random blood glucose test, which checks your blood sugar at any time, no fasting needed. If the number is 200 milligrams per deciliter or higher, it suggests high blood sugar. Next, they may ask you to do a fasting blood glucose test, which means not eating or drinking anything except water for at least 8 hours. If your fasting blood sugar is 126 milligrams per deciliter or more, that points to diabetes. Another common test is the oral glucose tolerance test. You start by fasting overnight, then drink a sugary solution. Blood sugar levels are checked at intervals over about 2 hours to see how your body handles the sugar. If your blood sugar is 200 milligrams per deciliter or higher after 2 hours, it indicates diabetes. The hemoglobin A1 degrees Celsius test is also used. This test measures your average blood sugar over the past 2 to 3 months. An A1 degrees Celsius level of 6.5% or higher confirms diabetes. It's helpful because it doesn't require fasting and gives a broad view of your blood sugar control over time. Since type 1 diabetes is an autoimmune disease, doctors also look for specific autoantibodies in your blood. These are proteins made by your immune system that attack your own insulin-producing cells in the pancreas. Finding these autoantibodies helps confirm the diagnosis and distinguish type 1 diabetes from other types. Sometimes, doctors check for ketones in your blood or urine. Ketones are chemicals that build up when your body is breaking down fat for energy because insulin is missing. High ketone levels can signal diabetic ketoacidosis, a serious condition that needs quick treatment. Diagnosing type 1 diabetes often happens fast once symptoms appear because it can develop suddenly. Early detection is important to start insulin therapy and prevent complications. So, in simple terms, doctors use blood tests to measure blood sugar levels, check for long-term glucose control with the A1 degrees Celsius test, and look for autoimmune markers. These steps help confirm if you have type 1 diabetes and guide your treatment plan.